Hi, my name is Julie Peterson, and I'm a psychiatric nurse practitioner student at Purdue University Global. My patient I wanted to talk about today was one that my preceptor and I had encountered during the inpatient rotation that I had done this past weekend. Um, I was there Saturday and Sunday both days, so it was good to be able to see a little bit more of him as the day continued. On Saturday when we saw him, he was, he had originally came in for just kind of acting crazy behavior. What he said, he was acting like you know, a butthead basically, and kind of got out of control. He said he wasn't doing any drugs, but he was positive for everything. And then he has a medical marijuana card, and but he admitted to that. But anything that was illegal, he had denied, and then said he didn't know it was in there. So that was probably part of what had caused his acute psychosis. Normally he does okay. He might have a bit of a learning disability, a cognitive impairment, and then he was also just very intrusive. When we were on the unit, he would come around and just keep trying to get us to get him out of there, to let him go home. Um, and then, you know, his demeanor had changed when we were talking to him. He just kind of shifted his mood, and just at first he was like real pleasant and intrusive and kind of over the top, and then he got to be angry and intrusive. And then on Sunday he kind of really seeing, and he would put words into your mouth. He was like, well, you said I was going to go home, and of course no one would ever say that to him, but certainly we hadn't said that to him on Saturday. And then he was just a little bit more angry. We had to get him to take an extra Seroquel just to get him to calm down, or Zyprexa. It wasn't Seroquel, Zyprexa. We had him to take a Zyprexa just to kind of calm his mood down a little bit. And when we were there Sunday, we had some other patients we were seeing. So by the time that we had finished with the rest of the day, he had kind of was settled down. He was sitting in the dining room, just watching TV. The dining room, which is the day room, just sitting there watching TV, and seemed to be pretty pleasant. So something I'd probably take away from that is, at first, he seemed fairly okay, but then you can kind of tell that he had some other things. He was really trying to talk you into it. So that's why I don't know if he had a cognitive impairment, or if he just cognitively delayed, or if he just really had a um, was just kind of really trying to, I don't know what the word for this is, just kind of really sweet talk you into doing what he wanted. So that was kind of where we were at with that. So if you have any questions or comments or anything, please let me know. Thank you, and I'll see you next week. Bye bye.